Can you give me an example of quality healthcare?
Yeah, as I mentioned earlier, in oncology, delivering quality care does not only mean treating each case appropriately and safely, but also treating each case as individual human experience with its sets of challenges and difficulties that are specific to that patient. And that involves getting closer to patients' emotional struggles and listening to their suffering and trying to understand their personal philosophy about life and death. Um, so an example, say you have three patients with lung cancer with the same stage and the same treatment options. An oncologist can go in a room and present the evidence-based treatment plan to each patient according to the national guidelines. But these patients are not the same people. One patient might be a healthy grandfather whose goal in life is to spend quality time with his grandchildren, and it's summertime, and he wants to go to the beach or amusement park with them, and he doesn't want to lose his hair. It's important to him not to make the young kids feel anxious about him. So I listen to him and I understand his point of view. I don't ridicule or discredit his concerns about his hair, so we list the treatment options. And although the one that would not involve losing his hair is not the best based on your clinical evidence-based data, but we go with it because what's important to him at that moment is not the higher response, but the chance of not going bald. Uh, same situations. The second patient with the same stage of cancer, same treatment options, but this one is young and he has to work to support his family. He's the breadwinner, so we work his chemo regimen around his work schedule. He's worried that his wife doesn't understand why he's tired and why he can't do what he used to do with the kids. So I bring them in and we talk about what she can do to help him, what she should cook at home, what she should tell her kids about why their father is not being as active with them. And we bring to light all the possible collateral concerns and that is a lot of the tremendous pressure the family can go through during such a challenging time. Third patient, same type of cancer, same stage, but this one is an older patient. He has dementia, and he can't make his own decision about does he want to go through treatment or he wants to opt for supportive care, and the family needs to make that decision for him. So I meet with his daughter, and we talk about the treatment options, the possible side effects, and most importantly, we talk about him, about the patient, about his life prior to his diagnosis with dementia. What was his philosophy, his values, and based on that, we conclude that if he were to make his own decision, he probably wouldn't want to receive chemo, and we opted to enroll him in supportive care program. These are three examples of what quality of care is not about only, especially in oncology, it's not about an algorithm that you go through. It's about individualizing what each patient needs and what their priority and what would be best for them at that time.